Now, papilledema is edema, right? It's edema in the actual eye. Okay, so if you can see this big old puffiness thing right here in the eye, in the back of the eye, it should not be all puffied like that. All right, these veins here should not be, or it might be arteries. They should not be as big as they are. All right, so you got a lot of pressure going on in this eye, and that's basically what it is. So this your optic nerve back in here in that optic disc area, and it's really swollen up. Okay, so that's what papilledema is. Okay, well, let's think about that. Why would you get edema in here? You get some kind of swelling, something's going on, something's causing, again, the whole problem is still the increased intracranial pressure, right? So because of that, you're going to get the same stuff we've been talking about. You're going to get the headache, you're going to get the nausea, you're going to get the vomiting. You might have vision problems. Obviously, if your optic nerve is all swollen up, yeah, duh, it would make sense that you would have vision problems, wouldn't it? Okay, increased intracranial pressure is the main cause of papilledema. That pressure is causing that fluid to go somewhere, and if it's swelling up your optic disc, then that's what we're kind of talking about here, right? Okay, reasons: meningitis, encephalitis. We talked about both of those already, and you can see where that increased intracranial pressure from either of those is going to do that. We talked about trauma, cerebral trauma. Don't memorize cerebral trauma. We already talked about, you know, the epidural, subdural, arachnoid hematomas and all that sort of thing, right? Bleeding into the brain, duh. And we would just add on there a brain tumor, right? You got any kind of mass inside your head that's going to increase your intracranial pressure also. Kind of duh. I think at this point, I hope we kind of understand this, and we could almost make it up because it's all the same stuff over and over and over again, right? Except that papilledema, obviously, you can tell from everything else because it's more of a symptom of all the other things that we talked about, isn't it? So therefore you have to treat it depending on what caused it in the first place, right? That kind of makes sense, I would think. So what you're actually treating is the cause. You're not treating the papilledema per se. It'll go away once you fix whatever the problem was that caused that increased intracranial pressure in the first place. Aneurysm, same aneurysm that we've seen earlier in the course. There's no change here. We're just kind of reminding you, since we're in this category and it fits with this module also. Okay, so hopefully this is review about, you know, the Berry aneurysm. I don't know if you've ever heard it called saccular aneurysm before, whatever. Most of the time you do hear Berry aneurysm because remember it looks like a berry. Where you had your arteries where they kind of merge into one, and right in that spot where it kind of forks, you get this aneurysm, and it kind of blows out. And if it blows out, obviously you're right in the middle of your brain on these middle meningeal arteries and that sort of thing. So that's going to cause a problem. Where those arteries are is in the subarachnoid space, so now you get an acute subarachnoid hemorrhage. This is pretty serious kind of stuff there when that thing blows. All right. Fusiform aneurysm. Again, fusiform always means like a fusiform shape, an oval kind of shape. And you're going to get that with the arteriosclerotic changes, as in hardening of the arteries. And you get the hardening of the arterial walls from, you know, calcium deposits and that sort of thing. Calcium makes it really thick, and not thick so much as it's brittle. Okay, so that could obviously blow, and if you blow that aneurysm out, then it's the same as any aneurysm, it bleeds. Okay, a lot of times, often, they're asymptomatic without symptoms until they rupture. Okay, and then of course you got major problems. The exception would be is if that aneurysm, even though it's ballooning out somewhere in your brain or body, this is the rest of my artery, it's normal. If that thing's pressing on something, then of course you're going to have some symptoms from that. But the major symptoms obviously come when it blows, all right? Because it's putting pressure on the brain. And that's what I was talking about is, if the aneurysm hasn't popped and it happens to be pressing on, your optic nerve or whatever, causing you headache, eye pain, that sort of thing. It just kind of depends on where it's pressing. Alrighty. If you rupture it, again, you're bleeding into your brain and it hurts like mad. The people that lived through it say it was the worst headache of my life, with or without loss of consciousness. And obviously, you get neurological symptoms. Nothing really new there. There's our little saccular or Berry aneurysm picture up here. So there's nothing new. That's balloons out. Obviously, if that presses on something that should be up here, that's going to cause problems. This is where it blows, and this is our fusiform shape. Okay, so nothing new on that, I don't think. Okay, that's that little Berry aneurysm I was trying to draw before. All right, where they call it the circle of Willis over here. Anyway, it doesn't really matter. You got these splittage off, and the Berry aneurysm is on that anterior communicating artery that goes from one side to the other of the brain, and if that blows, obviously you got major arteries in there. Alrighty, so there it is down here. I'm not even sure where else to put it. This is kind of what I was drawing, is from this view right here, and nothing else to add on that. Okay, pituitary adenoma is yet another switching of gears. Okay, well, it's an adenoma as in adenocarcinoma, so it's a tumor, right? So this is a tumor. Well, this tumor particularly tend to be benign. They don't tend to be invasive. They don't tend to metastasize anywhere, go anywhere. They're not typically, doing anything other than sitting there and getting big. Okay, well, where are they sitting? They're sitting in your pituitary gland. So if this is that's a really, really big pituitary tumor right here, sitting right there. Hard to really tell from this view, but this is, your pituitary is supposed to sit in your sella turcica area right in here, and everybody's happy. But obviously, if you get a big old tumor in it, then that's a problem, because there are a lot of things it can press on. All right. Also, the problem is that pituitary gland has a whole lot of hormones in it, right? If you remember all those many hormones. Anyway, we'll get to that in a second. 1 in 1,000 adults, so this is fairly common, I would say. You may know 1,000 people for all I know. Anyway, causes DNA mutation. Okay, it's a cancer, DNA mutation, or a tumor. I mean, that makes sense, right? That's not unusual for a tumor to be caused directly by a DNA mutation. Okay, we'll talk about the signs and symptoms and function in the next slide with all those hormones. But, oh wow, look at this. Nausea and vomiting, headaches, visual changes. Wow, that's unusual. No, it's not. That's not unusual at all, is it? Anything that increases our intracranial pressure is going to cause the same thing, right? So don't stick stuff in the brain and take up space, or it'll cause nausea, vomiting, headache, and visual changes. Now that I think about it, is it just me? Or if you are studying too much and working this brain really, really hard, you're leading to the same increased intracranial pressure because your brain's getting bigger and you get headache and nausea. No, that's probably just me. Anyway, kind of a stretch right there, but that may explain why I've had a headache for the last 20 years. Anyway, testing. We'll test the hormone levels. We'll talk about those hormone levels on the next slide, because that's going to really nail it down on which hormones are being affected by that pituitary gland, what's being increased, okay, which hormones. You can see it, of course, on an MRI. It would not be, or a CT for that matter, it would not be hard to find at all looking for that big sucker. And you can always biopsy it. What? How do you biopsy a thing that's sitting right in the middle of your brain? Believe it or not, they tend to go... Are you ready for another awesome drawing? Okay, I'm going to say that my eyes are here. probably completely inaccurate. But that's my eyes, and then I'm going to go ahead and make it, you know, my nose. It's a funny looking nose, you know, and then mouth down here. Well, that's a weird mouth. Anyway, that's a really weird mouth. It's got anteater mouth. Anyway, the nose. All right. Believe it or not, that's kind of how they go in, is they go right through the nose into your brain and chop it out, pull it back out. Okay. Makes for less scarring, and it's pretty much the most direct route. You just got to get through a little bit of bone and you're there. Anyway, treatment, surgery, get rid of it. That is called a hypophyseectomy, as in the pituitary gland. Oh my gosh, now I'm blanking it. What did they call the pituitary gland? They called it the hypophysis? Something like that. I can't remember what it was called. There's another name for the pituitary gland, and that's what this is. This is what it's referring to as the hypophyseectomy. Any ectomy is taking something out. They're taking out the hypophysis. Something like that is what another name for the pituitary gland. Anyway, and of course hormone replacements, depending on exactly what's going on with those hormones that are supposed to be in that pituitary gland. Alrighty, radiation. Oh, by the way, if you're removing the pituitary gland, you're going to have to replace your hormones. That's really what that's saying. Radiation therapy, again, if you're destroying the pituitary gland along with that tumor, you're going to have to replace your hormones. And then drug therapies for whatever the other problems are. And that just kind of, you can kill tumors with certain chemotherapeutic drugs is all that's really saying. Okay, don't really need to get into that part of it too much. So, most commonly the hormones involved are, before I get into that, is the main three. Okay, now in the pituitary gland, you have all sorts of hormones in there, right? Well, you know, your TSH, your ACTH, your FSH, LH, your growth hormone, prolactin, endorphins. We don't really talk about those very much. The main problems, the main ones that tend to be affected in pituitary adenomas are these ones that you see circled, obviously. Adrenocorticotrophin hormone, which goes to the adrenal cortex in the adrenal gland, and that's going to kick out what? That's going to kick out your cortisol, right? The growth hormone is, you know, your entire body, and it's growth hormone for growth. And your prolactin is going to obviously have to do with like milk production, right? Milk. So those are your main three. The ACTH, the growth hormone, and your prolactin are the major problems that you tend to see with these pituitary adenomas. So prolactin, what does it do? I just said that. It releases milk, galactorrhea. Okay, so 30% of all pituitary adenomas are the whole prolactin problem. Again, not a major problem. Well, not that it's convenient, but if a female has that, you know, she starts lactating all of a sudden, it might be weird, especially if she doesn't have a young child, but it's not going to freak her out too much. You go ahead and see a man with a prolactinoma and see what happens if he starts growing, you know, man parts up there, and all of a sudden milk starts squirting out, and he's going to kind of freak out about that. Okay. Next one, ACTH, adrenocorticotrophin releasing hormone. Already talked about that one. What does it do? It goes down and it stimulates the adrenal cortex to produce and release cortisol. Okay, Cushing syndrome. I don't know if we've ever talked about that before, but that's what the increased cortisol will do. You get into Cushing syndrome. I want to see if it talks about it anymore. No, you get into the Cushing syndrome down there, and you get cushy. Okay. It's not why it was named that way, but it causes, you know, the increased cortisol. Increased cortisol is a stress hormone, right? And that stress hormone is going to, what? It's going to increase your sugar. Okay, so increase your blood sugar by quite a bit. It's going to and it's going to cause more edema. Okay, and basically you swell up. You get a buffalo hump on your back, basically a big fat thing on your back. Your face swells up, and you look roundish. So you get cushy from too much cortisol or cortisone. Okay, and then there's of course growth hormone, and it makes you grow, right? So if you are a child and you have an increase in growth hormone, you're going to get really tall. If you're an adult and you have an increase in growth hormone, your bones are going to thicken. Okay, like the big bodybuilders that inject steroids. And once you're done growing, the only place your bones can go is wide, right? Acromegaly is what that is called when you grow wide like that. Okay, there's a picture of a huge pituitary, well, it's an MRI of a huge pituitary adenoma. Your sella turcica is right here, where it's kind of sitting there in that sphenoid bone. I think this is probably your lesser wing of the sphenoid bone down here. Anyway, it's supposed to go across. That pituitary is supposed to be like so, right? Well, now it's huge. Okay, obviously a problem as it presses on different things, and you have your, where's my, that must be my nose. So if there's just my nose-ish area coming through that way, and your eyes up here. Okay, and you're gonna press on some optic nerves and that sort of thing that goes through there. Alrighty. What do we got here? Wow, that's a big old sucker. That macro, as in big, macroadenoma. So that's really huge. And as you can see, it's kind of crunching off that carotid artery down there. That would be bad. But I mean, that's, look at that sucker. This is macroadenoma. That's a monster. That is a monster adenoma right there. If you notice, it's also pushing pressure everywhere it goes. And this was supposed to be the lateral ventricle. And that lateral ventricle was supposed to be open because that's where your cerebrospinal fluid is flowing through. You can see right here what got crunched off. So now you're actually cutting off your cerebrospinal fluid flow, and that's never a good thing. 17 minutes, hypertension. Yeah, let's talk about that. There's not really a lot to talk about hypertension. We've seen that many, many times before. You want to call it 140/90 is when we start talking about being hypertensive. Okay, the normal adult is what, 120/80-ish. And of course that's very variable depending on age and even sex, and obviously exercise and that sort of thing. Okay, children are much lower blood pressures. Okay, pre-hypertension, well, 120 is good, so anything above that to anything where it hits the limit, okay, 80 is good, so anything above that till when it hits the limit, so duh, right? Atherosclerosis, okay, what was that other thing I said earlier? I said arteriosclerosis, arterial sclerosis. That's not the same thing as atherosclerosis, is it? This one has arterial, and that was our hardening, right? Because of calcium, I said. Well, atherosclerosis is a subcategory of arteriolosclerosis, and that's where you get the fat buildup. Okay? So if you have a fat buildup of, you know, maybe a high cholesterol or something, and this is your artery, and it starts building up that plaque, right? So as you build up this plaque, it takes up space in that artery, and you can't get as much blood flow through there as you used to be able to because it's in the way. So you can see where it has to fight harder to get through this brand new small space in here, and therefore your blood pressure is going to go up. Duh. Not a big thing, okay? Anxiety and stress, okay, can also cause you to be hypertensive because, again, stress, maybe you're releasing some cortisol in there, cortisone in your blood, and that's increasing your fluid, just like in Cushing's. It's increasing your sugars in your blood so that you have that energy immediately available. It's increasing because of the sugars. Sugars is stuff, And as you put more stuff in there, it sucks more water into that stuff, and therefore you have hypertension again, right? Same thing with sodium. See how that works? Sugars are stuff, so is sodium. So you put more sodium in there, then more water is going to chase that sodium, and therefore you have more fluid in your artery, and your artery wants to expand. Yes? Yes. Kidney disorders, same thing. What do you get? 20 to 25% of all of the blood coming out of that aorta goes down to the abdominal aorta and you know, kind of shoots off right to your kidneys. So those kidneys, if you have problems with those kidneys and you cut that blood flow off or something, or increase pressure, then it's going to send the pressure back that way, which means now it has to go somewhere else, right? And it's going to increase your blood pressure everywhere. Signs and symptoms. Well, a lot of times you don't feel anything. Okay, your blood pressure goes up, and yeah, whatever, didn't even notice. A lot of times it's going to hurt. Okay, headache, same kind of thing. You're still increasing pressure, and it's going to, if it's in your head, it is still going to cause increased intracranial pressure because of the arteries now pushing on it, right? Because now you get bigger arteries than they used to be, okay, because of that increased blood pressure. Well, that pushes on things too. Arrhythmias, okay, as in it's going to cause heart rhythm problems. Whether it's too fast or too slow is yet to really be seen here. Chest pain, it hurts to not have the correct amount of blood flowing through your chest and your heart, especially. Nosebleed, again, in the nose you have very, very small vasculature, the arteries and veins, and if you increase your pressure, then they get bigger, and as they get bigger, they might pop, like little bitty aneurysms, and bleed down your nose. That's my nose-ish. Funny looking dude, kind of like a hippo guy. Anyway, I never said I was the best artist. Actually, you know what? Get rid of that. That doesn't really look good when I think about it. That's not the best picture ever. Forget that ever happened. Okay, risks. Risk for what? Risk for hypertension. We already said that. Atherosclerosis, an aneurysm. Oh, I see. Okay, this kind of goes both ways, where atherosclerosis can cause high blood pressure, but if you have high blood pressure, it can also cause atherosclerosis. It can go that way too, where that high blood pressure is always pressing on everything, and that can cause it to increase the pressure of you're pushing the junk onto your walls, and maybe it's staying there because you have more pressure pushing your cholesterol or whatever it is onto your walls, okay, and it gets stuck there. So that works that way too. Obviously, the more pressure that you are putting through those arteries, then the more chance of it, you know, blowing out and causing an aneurysm out there, right? Heart failure, yeah. High blood pressure would definitely lead to heart failure. Stroke, sure. Again, if you blow an aneurysm and it bleeds in your brain, you're going to get a stroke from ischemia to that part of the brain. Vision loss, talk about that already. Especially, again, if you're adding too much pressure into that retina in your eyes, then that can also cause a vision loss. Retina is the back of your eye. Okay? Metabolic syndrome we'll talk about next thing, but that's just part of it, and it's the high blood pressure part of it. And you know, testing is, you know, clinical. Stick a blood pressure cuff on there, and you can figure out that you have hypertension, and then all you got to do is figure out why, right? Rule out the things above, because it might be just hypertension and there's absolutely no risk factors or reason why that does happen sometimes in people. Okay, what did I just see? Oh, when I hit that button, it threw in the aldosterone and renin problem. If you have, you know, aldosterone sucking salt, right, and renin with increasing blood pressure, so that can obviously cause increased blood pressure too. Okay, we are at 24 minutes. Sadly, I need to break this off and make yet another part to this video.